My name is Lydia Jackson, and I am a highly sensitive person, and currently I'm living here in Brazil for the last few months. I'm originally from Houston, Texas, and I wanted to make this video to talk about some of my experiences while traveling and just living in a foreign country during a pandemic, and especially being a highly sensitive person. For anybody who doesn't know, a highly sensitive person is someone whose central nervous system is more sensitive than the average person. And we're estimated to be 15 to 20% of the population. And this trait is also known as sensory processing sensitivity. I'm also a US Navy veteran. I also have like a congenital sort of issue with my kidney that I was born with, where my left kidney is smaller than my right one, and that has meant that I've had some, urinary issues throughout my life, and I also struggle with chronic pain. Oh, and I also have complex PTSD and anxiety/panic disorder, and recently I've actually been realizing that I probably have ADHD as well, or something similar. So all of that to say that, there's a lot of different factors going on for me personally that mean that doing things like traveling to another country during a pandemic is very, very challenging. I wanted to talk more about just like my health and healthcare, and in particular my amazing healthcare team that I'm super grateful to have and to be able to stay connected with while I'm traveling, while I'm here in Brazil, and while I'll continue to be traveling to different countries. Because as much as healthcare is such an important thing in our lives, as much as it's difficult to get access to when you're living in one place and you're stationary, it makes me all the more grateful that I'm able to have access to my healthcare team, who their official company name is Regenerating Healthcare. And the team is made up of my primary care doctor, Dr. Ruby Shaw, and then Stephanie Mo Davis, who is my sort of life coach and HSP empath, trauma-informed spiritual guide. And she has experience, working with CPSD, and she also has history of kidney issues. So I'm super, super grateful to be able to work with both of them. And they're basically trying to regenerate the healthcare model, and they've come up with a really new way of going about doing healthcare. And I'm just super, super grateful to be able to work with them, because since I've been in Brazil, I've been able to keep in touch with them over email. We've been able to have meetings over Zoom, and I came down with some symptoms of what was most likely strep throat about a month ago, and I'm so grateful that as soon as I emailed both of them and told them my symptoms, almost right away, Dr. Shaw was able to send an email back, or actually she called me right away and was able to talk to her more about my symptoms, about what was going on, and she gave me some recommendations. And it will depend from country to country where I'm at, the capability to either prescribe me things directly, but she told me before that if she wasn't able to get me a prescription directly herself, she would get me in touch with resources and ways that I could still get access to those things. And that's exactly what happened. I was able to do the Brazilian version of Doctor on Demand, do a video consultation with a doctor here in Brazil, who then got me the prescription and got me the specific antibiotic that my doctor, Dr. Shaw, was able to prescribe. And I'm so grateful to have this working relationship with her, because she's been my PCP since 2014, when I was going to the VA hospital in Houston, and she was assigned as my PCP there. And then she left the VA, but then after I got a job that offered employer health insurance, she was working at Houston Methodist, and thankfully was within the network that I had for my insurance, and I was able to keep seeing her through that insurance for a while. And we've kept in touch, and again, she's still my PCP, even though it's not through a formal insurance program, but I actually prefer it that way. And I sent her some pictures of what was going on with my throat and stuff like that, and she was just like incredibly helpful at, helping me to figure out what it probably was, what antibiotic to prescribe, and I kept her up to date with my symptoms and everything and how I was recovering. And then a week or two later, I had a video session with both Stephanie and Dr. Shaw in order to just like check in and let them know how I was doing physically, mentally, emotionally, and spiritually, and all of that. And that's the overarching reason why I'm so grateful to have them as my healthcare team, because they both understand the importance of holistic healthcare, and that's what they're both working to really create, is a new model of healthcare that does respect, holistic health and tries to treat the whole body, and not just like, the part of the body that's hurting, but treat the entire person. And so I'm super grateful that Stephanie, being an empath herself, she understands how being a highly sensitive person and being more empathic can, all the things that I'm doing, living in a different country, just all the different things that are challenging, and her also being trauma informed and having that experience, and then Dr. Shaw also being like understanding, of highly sensitive people, understanding trauma and how it affects our bodies. They work so well together, and I'm so grateful that they get me, they understand me. And where some doctors may not understand highly sensitive people, and they may think that, we're just feeling sorry for ourselves, or that we're just like too sensitive or something, and they won't be considerate of the different kind of healthcare that we might need, or the different ways that we would like to be treated, just within having a doctor's visit, how we want to be listened to, all those different things. I'm so grateful that not only do both Dr. Shaw and Stephanie understand me, but they value me. They value my insight as a highly sensitive person. And just every time that I talk with them, I always come away feeling understood, like I said, feeling valued and feeling supported, feeling like, okay, I have people who care about me, they understand me, they have the knowledge and tools to help me with the different things, the different challenges that I'm going through. And I'm just so grateful for them and what they're doing with healthcare as far as trying to completely revolutionize it to make it more human, more holistic, and better all around, better for providers and better for patients. So I highly recommend, if anybody's interested, Regenerating Healthcare. And they have a YouTube channel as well. If you go to the YouTube channel under the same name, just search that in YouTube, they have a lot of videos up already where they both just talk about all kinds of things, their plan, their vision, the reasons why they're trying to, change the healthcare model, all the ways that it could be better. So if you're interested, I highly, highly recommend checking them out, getting in touch with them, especially if you're someone like myself where, you might be traveling a lot, and or even if you're not, but you would like to work remotely with a team like them. Highly, highly recommend. Can't recommend them enough. They're incredible people, incredible women with incredible knowledge and insight and experience, very highly credentialed, and I'm just super proud to call them my healthcare providers. And they also work on a flexible pay scale as of right now, so definitely reach out, and if money is something you're worried about, they'll be able to work with you and figure out something flexible. So I can't say enough good things about Dr. Shaw and Stephanie Mo Davis of Regenerating Healthcare.